Vikram, a lot of discussion over the past couple of months has been around which nations and which states have handled COVID-19 better. Now, we have Kerala, we have South Korea, we have Vietnam, among the many countries that whose names have come up. How do we go about measuring success? In the end, it might come down to number of lives lost, but also to what extent and how badly the national economies are affected. So, and in past pandemics, it was typically been, in terms of number of lives lost. But I think in this case, this time, success stories or failures will have to be probably measured in terms of both lives lost and, to what extent their economies were affected. What do you think?
Yeah, no, absolutely right. And when we talk of lives lost, it's very important to talk of excess mortality. So that is a concept which really, what it does is it counts the total number of deaths that have occurred over a period of time and compares them with a reference period, typically the same period of time in the previous few years, which is then averaged out. So say, for example, in the first half of each year, 100 people died on average in the last 5 years. Then what we want to look at is how many people have died in the first half of this year, and if it's say 150, then we have an excess mortality of 50%. Then we want to unpack that and see how much of that excess mortality is because of COVID-19, because of course there will also be excess mortality of other conditions because the health services have been shut down or diverted, people can't get to the hospital because public transport was cut and so on. So that is a very important metric. Tied to that is the metric of the long-term excess mortality that will occur because of poverty, the economic recession. So it isn't just how many people died in the period of comparison, but in the months and years ahead, and how much of that mortality can be attributed to the economic recession. So, this is work that will need to happen going forward. But you asked me a really important question. The first part was about different countries and how they responded. To me, this is going to be a really important analysis. Of course, we're in the middle of the epidemic, and it's too early to say, which countries have done well for sure. But what we can say right now is East Asia, where it all began, particularly China, has done remarkably well. Consider countries like Japan, China.
You think China has?
Well, if we have to accept the data that we have from them, yes, they have.
Okay.
They've done incredibly well. Their per capita mortality is now, one of the lowest. And I don't want to interrogate the numbers because, we have to trust the numbers. Otherwise, we'll end up not knowing anything about anything if we start doubting the numbers. But yeah, certainly east of India, they've done very well. Western Europe did very badly during the acute phase of the epidemic, but they've actually started recovering very well. If I have to look at the outliers of poorly performing countries, the worst performing are the US, Brazil, Russia, and actually India. Because in the case of India, after 2 months of the lockdown, we are still nowhere near the peak of the surge. By now, the surge should have actually been totally flattened. We should be seeing the end of the surge. We're actually on the incline. And we have, of course, India is a continental country, so we have multiple epidemics happening at different stages, and so whereas Bombay may look really bad now, make no mistake, there'll be other parts of India that will look really bad.
No, Delhi is beginning to look worse every day.
Yeah, and as the migrant workers return to Jharkhand, Chhattisgarh, Bihar, and so on, you will see surges happening there as well. So I think India's performance in terms of numbers of cases is going to be one of the worst in the world, without a doubt. As I mentioned earlier, our defense is going to be our youthfulness, our lifestyle, etc., which means that our per capita mortality will be amongst the lowest in the world. But that's not because of anything we did to control the epidemic. That was always part of the age and social structure of our system that has protected us.
Timing seems to be everything, is it not? We were discussing this a bit earlier. Apart from strategy, so keeping all things constant, one disputed facts that seems to be emerging is that to deal with a problem, you first have to acknowledge that there is a problem, or we'll have this problem at our doorsteps. How important has timing been in dealing with COVID-19?
I would say that actually, our government did react very quickly. I would differ with what they did, but I think that they reacted so early was a good thing. I wish they had actually done what they're doing now back then, and incrementally lock down places according to where there was, a high density.
Cities in
infection.
particular. Cities in particular.
Exactly, exactly. And I also wish that they had allowed, people can argue that in the worst case scenario, that's what the government did, right? They looked at the models, the forecasting models, and said, my goodness, what is happening in Italy happens here, which is what was happening in March. This country will really, really suffer terribly. And I think that is a real scenario. And I can imagine making a decision with those data coming from Italy would have been terrifying. But there was a lot of unknown about the infection and the way it would spread in India, but there were a lot of knowns as well. There were many things we could anticipate. For example, we knew that the vast majority of Indians are day wage laborers. We knew that the moment we would have a policy that would stop them from working, they would stop eating. We knew that, like any human being anywhere in the world, when you are unemployed and fearful, you want to return home. We knew that a huge number of people in our urban environments don't call their urban environment their home. They called some other part of India their home. We knew all this. None of this was discovered after March. This is a fact that everyone knows. So the question I have for myself is, why did we not allow for sufficient time for, number one, people who want to return home to go home using public transportation when the epidemic was very low and there was no risk of spreading it into the rural heartland? Why did we not allow employers sufficient time to organize some kind of basic support for their staff? Why did we not use resources in the community like schools, which were now emptied out as dormitories for people who were essentially homeless to live in until we saw through the worst? Why did we not allow a preparation for our country and our people to actually endure what had to come? I think this is what really worries me so much, is so much of the human tragedy that we have seen in the last 2 months could have been anticipated with all that we knew and could have been totally prevented.
This is again, we talked about how we looked at what was happening in Italy and what was happening elsewhere in Europe. But this is also linked to the same article I mentioned earlier in the Express about COVID-19 and TB. How strong is the Western bias in our understanding of public health challenges that countries like India or others face? And by Western bias, the reference is not just to countries, what countries do or what is happening in them, but also the public discourse around health that is shaped by these countries, the various international organizations, whether it is WHO or even the Bill and Melinda Gates Foundation. So the bias which is informed by the discourse that these countries engage in, these organizations engage in, why did we not recognize instead, these simple facts about India, when we took those decisions? What is the source of this bias?
So I think the source of this bias comes from a highly technocratic approach to the management of what is a social phenomenon. I think the fact that decisions were being made almost entirely by biomedical scientists, most of whom work in tertiary hospitals, is an example of that bias. Whereas an epidemic of this kind is a social phenomenon that is spreading in the community. Very few public health professionals were involved. Very few of the great expertise in India on the control of epidemics have been involved. But most importantly, social scientists have been absent. This is a social phenomenon, Yeah. You're putting 400 million people out of work. You're stopping all forms of communication and of transportation. This is a massive social experiment. And to engage with the social scientists in this country would have been, in my mind, one of the most important groups to consult alongside public health professionals. But sadly, most of the people who've been advising the government actually have never stepped out of a tertiary hospital. To me, that's a strange kind of thing. And this, of course, is something that we're aping the West. And I believe that our greatest strength, our greatest asset, is our primary care system. Our greatest asset has been our community health workers. If we've eradicated polio, Pushkar, and that is a great success story for India, it didn't come from tertiary hospitals. It came from ordinary health workers visiting every home and doing the pulse polio program. If we've eradicated smallpox, it's through vaccination at the level of the community. Our greatest public health successes have been community driven, not by private hospitals, not by tertiary hospitals. I'm not denying that they play a role, but they don't play a role at the level of public health. And I believe that we lost sight of our great successes, our great assets, our great stories, and instead tried to ape a Western model. And that, I think, is not another lesson for the future.
So what you're basically saying is that while we have public health experts, those associated with, for example, the Public Health Foundation of India, these were not people who were consulted or, whose advice was sought.
Well, certainly if I look at the composition, if I just look at the composition of the committees that were formed by the government, if I look at the health ones, the medical committees, they're almost entirely dominated by tertiary hospital physicians, I'm not saying that this is not an expert group. I'm just simply saying there's a huge amount of perhaps far more relevant expertise. And also not just Delhi-centric, Pushkar. This is the other problem, right?
Yeah.
If you look at the expertise, almost everyone is Delhi-based. I mean, this is a lockdown that affects 1.3 billion people around the country. Where are the experts from other parts of the country?
And the capacity, we are a federal system, the capacity of different states to deal with, epidemics of this sort is different. Those are factors that perhaps needed to be taken into account. This is something that you have been writing on. I think a couple of years ago there was another article in which you had talked about political will, and this was sort of repeated again when you talked about how much political will that the government has shown in dealing with COVID-19. As a political science student, one of the things that we often worry about is or discuss is where will this political will come from? What can be the source of political will? And ultimately, political leaders in democracies or even otherwise, there needs to be some pressure from below, in the form of social protests, in the form of multiple NGOs which are sort of lobbying the government constantly that this is what needs to be done. One of the reasons why nothing has happened about TB is perhaps because there has not been any substantial movement from below saying that poor lives matter. We are talking about Black Lives Matter, but poor lives matter. Now on social media, of course, with so many opportunities to make these things important, how is it that our society or India in general, we the people, have failed in bringing about these pressures from below to bear on the government to address this? Is it simply because, as you wrote, TB is a poor person's problem? It no longer affects you and me, and therefore we are indifferent to it.
So I think if I just restrict myself in responding to the question of health, which is the area where I have some expertise, I think the reason why we don't actually have the kind of healthcare system that we all deserve is because we have a tiered healthcare system. The rich, the middle class, and indeed anyone with any money, even amongst the poor, basically go to the private health sector, which is utterly unregulated, completely unaccountable to anyone.
It's predatory.
Yeah, it's predatory in parts, but also completely unregulated. No one knows what goes on there. And the people who go to the public sector tend to be the poorest of the poor, or when we have epidemics. That's exactly when the government suddenly realizes that it is the public sector that is actually central to control epidemics, because it's the only sector which has some form of governance and stewardship, which is so essential when there's an epidemic. Looking forward, and let me be honest, it isn't one political party or the other. Every political party has failed India in this regard from the very beginning, from independence. One of the things that's really interesting is that at the time of, around the period of independence, two countries, Britain that was ruling India and India, its colonial possession, both instituted committees to look at the reformation of the healthcare systems in these two countries. We had the Bhore report in India and the Beveridge report in the UK. And remember, UK had a very similar healthcare system to India before 47, totally tiered, with the rich going to Harley Street and the poor living in squalor, etc. The UK had a Labour government immediately after Second World War.
And the NHS was born.
And the NHS was born and accepted the report. In India, we had a post-liberation government that looked at the report and said, we can't afford it. And we know what's happened ever since then. So, to be honest, I don't think this is the current government. It is a historic fact. And I believe, going forward, that there's a really unique historic opportunity to drop all political differences, to drop all ideological positions, to actually unite around the recognition that India deserves and needs a universal health coverage system. That is not to say the private sector does not have a role, but that the private sector must be part of a universal provider model. And that means it is fully accountable to, it is regulated by, and of course supported financially also by the public exchequer. I think this is an opportunity to fix a deeply broken system and create a universal health coverage program for India. If, for example, I look at China, if I look at East Asia, if I look at Western Europe, yes, they suffered also the pandemic, but they have made a quicker recovery from it, in part because of two things. They have a universal health coverage system, and secondly, they also have universal social welfare system, which I won't go into because it's not an area of my expertise, but clearly that's the other thing this response to the pandemic has clearly shown how fragmented our social welfare system is as well.
Well, it might seem to be a bit of wishful thinking, but after the Great Depression, the modern welfare states were born. But we also had at the center last year, and in a slightly different context, someone from Matrish Ghatak, an economist from the London School of Economics, talking about universal basic income. Maybe that's again something whose the time has come for coming up with something like that. To deal with the after effects of COVID-19. One last question, and then we'll wrap up, which is. What do you think will be the implications of the United States withdrawing from the World Health Organization?
Well, I'm very clear about that. It's a gigantic error by the United States. I think the World Health Organization, like any multilateral agency, can work better. But to actually remove support for the only legitimate agency that is there to actually coordinate inter-country actions at a time when there is a global pandemic, I cannot imagine a more short-sighted decision. If you want to reform the WHO, which I think many countries want to do, you have to do it from within. But to actually leave and not offer an alternative for the coordination of global health, I think is a fundamental error. And I'll tell you what, Pushkar, every country in the world is going to stand with the WHO on this. And I stand with the WHO on this too.
Thank you, Vikram, very much. You're going to be here in Goa for a while.
Well, Harvard has just announced that there is no access to any of our departments or offices till the end of August, and there's a very, very strong likelihood that all our fall semester teaching will also be done remotely. So it looks like I might remain in my second home here in Goa, maybe all the way through until Christmas.
Okay. So in which case, another 2-3 months from now, we will come back and discuss what's happened.
I hope that 2-3 months from now, we'll all have returned to life as normal.
Thank you, Vikram, very much.
Thank you, Pushkar.